Very common surgical procedure that I do not see that often very much now is PE tubes, the tubes that you put in for ear infections, recurrent chronic ear infections. Now, not to say that it does not happen. It probably still is one of the more common surgical interventions that we have, but the criteria to put in PE tubes was 3 ear infections in 3 months, 6 in a year. And when I first started pediatrics, we saw a lot of that. In fact, we saw twice as much as what we see now. And so many times when people are looking at the benefits of vaccines, the only thing that they look at is the death rate. They don't look at what we call morbidity. They look at mortality. And so many people are going, I don't know why we vaccinated against strep pneumonia. When I was a kid, we never even heard of it. You did. You just didn't know what it was called. You just had a lot more ear infections. You had a lot more pneumonias. You had a lot more meningitises. You had a lot more bacterial infections. You just didn't know what was causing it. You just knew you had it. And so when you went back and you looked at how many, referrals I was doing to, put tubes in people's ears, it was 2 to 3 times more than what I'm doing now. What happened? Well, vaccines happened. Strep pneumonia came out in 2000, became widespread use in babies at that point, then started doing some catch-ups. But that first 5 years that I was in practice, we saw a lot more PE tubes. Those ENTs, trust me, I was on their Christmas list because I was a good proportion of their income. Now, not so much. They might send me a card. So just know that is something that we used to see a lot more of. We see a lot less now.